Everyone, welcome to our webinar. Today's webinar is called From Congress to California Communities, the Federal Tobacco Control Act. My name is Leslie Zellers. I'm the Director of Programs at Public Health Law and Policy, and I'll be facilitating today's webinar. The acronym for our organization is PHLP. However, some of you may also know us as TALC, the Technical Assistance Legal Center, which is the name of our tobacco control work. PHLP helps communities pass laws to make the healthy choice the easy choice. In the area of tobacco control, we've helped dozens of communities limit exposure to secondhand smoke or require a license to sell tobacco products. Our co-host for today's webinar is the Center for Tobacco Policy and Organizing, which is a project of the American Lung Association in California. The center helps communities with the development of their policy campaigns and community organizing strategies. If you have any technical difficulties in the webinar, I encourage you to use the chat box, which is at the bottom left hand of your screen. So if you submit a question via the chat, someone should be able to help you. The chat box is also the way to ask any questions about the substance of the presentation. We're going to be taking questions at 2 points during the webinar, first after our first speaker and then again at the end of the webinar. And also a reminder that today's webinar is being recorded. You'll receive a link to the recording, including the slides, after the webinar ends. So let's get down to business. As many of you know, in 2009, Congress passed the Federal Family Smoking Prevention and Tobacco Control Act. This law gave the FDA authority over tobacco products for the first time. Now that it's nearly 3 years later, the law's effects are being seen across the country. At the same time, new local laws are more important than ever to counter the tobacco industry's efforts to hook new customers and keep current customers addicted. Here's our agenda for today's webinar. First, we're going to hear from Ann Simonu from the FDA with an update on the regulatory progress since the law was created and the actions the FDA is taking to enforce the law in California and other states. Next, Elisa Laird-Metke with PHLP is going to discuss what restrictions on tobacco products are contained in the law and the pending lawsuits that will affect the law's enforcement. Finally, we're going to hear from Vanessa Marvin with the Center for Tobacco Policy and Organizing about creating new local laws. Vanessa is going to talk with two individuals who helped create new laws to limit the sale of flavored tobacco. Ann Pearson with the Seattle-King County Health Department is going to describe the nation's first law banning the sale of flavored tobacco products in New York City. And Janie Burkhart will talk about Santa Clara County's ban on flavored tobacco as part of a local tobacco retailer licensing law. Let me tell you a little bit about our speakers. As I said, I'm Leslie Zellers, and our first speaker is Ann Simonu, who's the Director for the Office of Compliance and Enforcement in the Center for Tobacco Products at the FDA. Ann joined the agency in 2001, and she's worked in the FDA's New England District Office, the Center for Drug Evaluation and Research's Division of Drug Marketing, Advertising, and Communications, and also the Center for Devices and Radiological Health Office of Compliance. Our next speaker is going to be Elisa Laird-Metke, who's a staff attorney with Public Health Law and Policy, specializing in legal issues involving product marketing, the retail environment, and exposure to secondhand smoke. At PHLP, Elisa provides technical assistance and training on tobacco control issues to local health departments and community advocates in California. Vanessa Marvin is the Director of the American Lung Association in California's Center for Tobacco Policy and Organizing. Vanessa's been with the Lung Association and the Center for over 9 years. As part of her work, she provides technical assistance to local California Tobacco Control Program funded projects and coalitions throughout California on the development of their policy campaigns and organizing strategies. Ann Pearson is a policy advisor with Public Health Seattle and King County, where she works with the agency's chronic disease programs to develop and implement policy, systems, and environmental change in the areas of tobacco control and obesity prevention. Prior to joining Public Health, Ann served as Senior Legal Counsel for Policy in the New York City Health Department's Bureau of Tobacco Control. Janie Burkhart is the Tobacco Programs Manager at Santa Clara County Public Health Chronic Disease and Injury Prevention. With a 17-year history in public health, Janie's been involved in HIV/AIDS prevention, childhood immunization, environmental health, tuberculosis control, public health emergency preparedness, and tobacco prevention and control. In particular, Janie's managed the tobacco prevention and control programs for Santa Clara County since 2009. Now I'm going to turn it over to Ann Simonu. After she speaks, we're going to take a few questions since Ann will need to leave the webinar before we end. So I turn it over to Ann.
Great. Thank you all. And thank you for the invitation to join you in this important webinar. Last September, we awarded a contract with the California Department of Public Health, the Food and Drug branch. So FDA is looking forward to engaging and working really closely with all of the tobacco control folks in California. I just want to give you a brief overview of the Tobacco Control Act and where we are in its enforcement and certain things that have occurred since the President signed the new law on June 22nd, 2009. As the law is written, FDA has jurisdiction right away over cigarettes, cigarette tobacco, roll-your-own tobacco, and smokeless tobacco. The agency has announced that it plans to issue a regulation to assert jurisdiction over any other remaining tobacco product that meets the definition of tobacco product under the Act. Now, the law has certain restrictions in it that are already in effect. The Act bans flavored cigarettes, so those are cigarettes with certain characterizing flavors that are strawberry, candy, cinnamon, pineapple. The law also required the agency to issue a regulation that contained certain restrictions on youth access and advertising. Now, some of those provisions that became effective a year after the regulation was issued was that it prohibited the sale of cigarettes to anyone under 18 years of age. It required photographic verification of the age of the purchaser. It prohibits the sale of cigarettes in packages of less than 20 cigarettes. It prohibits the distribution of free samples of cigarettes and has certain restrictions on giving free samples of smokeless tobacco products out. It also has some restrictions on prohibiting tobacco brand name sponsorship of athletic and musical and social events. It prohibits the sale and distribution of certain items like hats and T-shirts that have the tobacco brand names and logos. And it also prohibits the sale of tobacco products in vending machines and self-service displays if a minor is present in that facility or permitted to enter at any time. So those are really the big provisions that are in effect right now. Under the Tobacco Control Act, it authorizes the agency to contract with the states, territories, and tribes where feasible to assist us in carrying out these inspections of tobacco product retailers within each jurisdiction. The first year, the agency contracted with 25% of the states and territories. So that was 15 states that we contracted with. The following year, by the end of fiscal year 2011, which was September 30th, 2011, the agency had awarded 38 contracts, 37 states and the District of Columbia, one of which was to the state of California. Now that contract was awarded on September 8th of 2011, and it was for over $1 million. We're working with the state. We had everybody go through background checks. They become commissioned federal officials, and they go out after undergoing training and undergoing all of the federal requirements in order to enforce the law, that they have begun the inspections. They enter retail establishments. Oftentimes, you won't even know they're there. We're using new technology with iPhones to document and collect the evidence that would support enforcement actions. They also work and hire minors to assist them in doing undercover purchases and to document the sale of cigarettes and smokeless tobacco to anyone under 18 years of age, and to also document the failure of retailers to check for a photographic identification. Now, once this program began back in 2010, and as we started rolling out one state after another, we began posting all of our enforcement actions that have been issued to date, and they're all listed on the FDA's webpage. So when we first do an inspection, the first time we go out to a retailer and violations are identified, we issue what the agency calls a warning letter. Now, this is a letter that's sent to retailers, and it delineates all of the different violations that are found at their establishment. It asks the retailer to respond to the warning letter and to identify how they plan to correct the violation, whether that be retraining their staff or adding educational programs within their retail establishments. Then we go out and we re-inspect the facility. If, in fact, there still remains violations or they continue to violate the law, then the Tobacco Control Act grants us the authority to pursue civil money penalties. Those are administrative remedies that are like fines, and they go up significantly. The second time we go out and inspect, if we find violations, we can pursue anything between $250, depending on the violation, all the way up to $10,000 over how many violations over a certain period of time. And this is all prescribed in the Tobacco Control Act that they give us that authority. For repeat violations over a certain period of time, we ultimately have the authority to pursue no tobacco sale orders against repeat violators of the same violation over a period of time. So the Tobacco Control Act has given the agency a significant amount of authority to enforce the provisions of the law as they become effective. And that would include not only the provisions of the Tobacco Control Act or any federal regulations that we issue to implement this law. Now, some of the enforcement tools that the law has given us include, as I mentioned, warning letters, civil money penalties, no tobacco sale orders. We also have the authority to pursue seizures against the goods to prevent the shipment into interstate commerce. We can pursue injunctions against the most responsible person at the facility. We have jurisdiction also to pursue criminal prosecution for certain circumstances. Now, who do we regulate under the Tobacco Control Act? Congress has given us the authority to regulate tobacco manufacturers, distributors, wholesalers, importers, and retailers, and that's anybody who distributes, sells, manufactures, markets these tobacco products that we currently regulate. Not only do we post all of the warning letters, but we also post the civil money penalties. To date, we have completed over 4,000 inspections working closely with the states that are currently under contract with us. We've issued over 2,000 warning letters to tobacco product retailers for violations that have been identified. And to date, we've issued more than 60 civil money penalties, and those are also posted on our website. Now, one of the questions we frequently get from the states is, under the terms of the contract, the primary obligation is to do these inspections to enforce the federal law. But can the states use that data to meet, for example, their SINAR obligations? And the answer to that is yes. We work with the states and the organizations that are under contract with us to have them conduct these inspections and submit the data to us to bring the enforcement action. But the data can also be used by those states to do enforcement under their state law and to also meet their SINAR obligations. And that's very important to the states. We're working collaboratively with the states that are currently under contract. We are aggressively reaching out to the remaining states to work with them and to award them contracts. We currently have an open request for proposal for the remaining states to submit their applications to get contracts with us also. So it's our intention and our goal to have all of the states, territories under contract with us by the end of this fiscal year. We look forward to continuing our relationship with the state of California. I'm pleased to say that all of the commissioning and background checks have been completed, and they began inspecting in January of this year, and that will proceed and continue. So with that said, I'm certainly open to any questions that the audience has with regard to FDA's enforcement of the Tobacco Control Act.
Thank you so much, Anne. That was really informative. I just want to clarify, a couple people have asked that why the slides aren't changing. Anne was just talking, so we don't have a slide presentation to go along with that, but we do have slide presentations coming up. So a couple questions, Anne. Just a clarification, the 4,000 inspections that have been done to date, is that for the entire country?
That's 40,000, if you can believe that. We've been very busy here. 40,000 inspections, and that's throughout the United States. And just to clarify, we began awarding contracts. I believe the first inspections began in November of 2010. So in almost a year and a half, we've completed, with the assistance of the states, 40,000 inspections to date, and we've issued 2,000 warning letters and 60 civil money penalties in the short time that we've been working in this program. Great.
And how would people contact you if there are violators that they know about?
Absolutely. My office is working on, trying to facilitate, getting some forms to put up on our website. But in the interim, we certainly encourage anybody to provide us any information about, people that you believe are in violation of the law. You can call 1-877-CTP-1373, or you can send email at askctp@fda.hhs.gov. And I assure you that all of the information is reviewed, and oftentimes it leads to further investigation through my staff as well as the states, and there are situations where they have resulted in the issuance of a warning letter or civil money penalty.
Great. And will communities know when the FDA is coming to do inspections in their community?
No, these are all unannounced inspections. Now, these are quick. These are not like anyone is familiar with the FDA, one of these in-depth good manufacturing practice inspections that you see at a manufacturer. These are commissioned state officials. They're commissioned by FDA to stand at our shoes and go in there and basically go through all of the different provisions. They look around, do they have a vending machine? Do they have a self-service display? Do they work with minors? Minors will go in, you won't even know. The minor will go to the clerk and they will ask to purchase, a package of cigarettes. If they sell it to them, they collect the evidence. That would be the cigarettes or the receipt. They complete their report and they submit it to the Center for Tobacco Products. And we review everything throughout the country so that there's uniform, equal review of all of these documents, so there's equal application of the law throughout all of 50 states.
And is that how you determine which retailers to inspect? Is it complaint-based?
No, it isn't. We, as you can imagine, some states are more populated than others. Every state we contract with, to do so many inspections in one fiscal year. It's our goal to, if we only get to 20% of them one year, then the next year we will do others. We certainly have identified certain communities that we know we've been directed by Congress in the Tobacco Control Act to make sure there's adequate coverage in minority communities. There's several factors we look into in determining where within the state that we will go to, but rest assured that we will see all retailers.
Great. Well, I know you have to go, so I really want to thank you for this information. We're going to post the phone number. Let me just confirm that. You said it's 1-877-CTP-1373, and the email was askctp@fda.hhs.gov?
Yes. And I
Great.
certainly encourage everyone. There's two things I want to mention to the folks on the webinar is I encourage you to go on FDA's website. That's www.fda.gov/tobacco products. There's a wealth of information on there. The center is very transparent. When letters are issued, they post them immediately, whether that's enforcement or if a retailer has been inspected and no violations have been found. We've created a database, and it's searchable by zip code and all different features, so you can get that information. The second thing is you can sign up to be on our listserv so that if any new information gets distributed, whether that's a new guidance document or a new regulation, we blast email all of those out to everyone on the listserv so you immediately become aware of anything new that the agency is doing with regard to tobacco products.
Great. Wonderful. This is extremely helpful information. Thank you so much for taking the time.
Great.
Okay, so I'm going to pass it over to Elisa Laird-Nutke to talk a little bit more about the law and the legal challenges.
Thanks, Leslie. Can everybody hear me okay? I want to thank Ann also for taking the time to speak with us today. We're really sorry that she had to get off the line so quickly, but we will post the email address at the end of the webinar where you can send additional questions if you have them. And we'll send an email out after the webinar and include the other contact information for them so that everybody will have that. I was asked to talk today about the lawsuits challenging the Tobacco Control Act, but before I talk about the challenges to the law, let me do a very quick refresher on what the Tobacco Control Act authorized the FDA to do. Some of this will overlap a tiny bit with what Ann just said, but I promise I won't belabor the points. So the Tobacco Control Act applies to 4 general areas of tobacco control, and so I'll just sort of talk about those briefly. One area that FDA can now regulate under the Act is marketing. So the Act contains restrictions on sampling and sponsorship and says that ads for tobacco products must contain only black text on a white background. That's commonly referred to as tombstone advertising. Several of the Act's provisions, including some of these, were challenged in a lawsuit, and I'll be talking about that in just a few minutes. The Act also contains restrictions designed to reduce youth access to tobacco, such as restrictions on sales to minors, vending machines, and self-service displays. Not changing. There we go. The Act finally allows the FDA to regulate tobacco products, including what they contain and whether new products may be marketed. And it also endeavors to provide more information to consumers than was previously available with new package labeling requirements. As Ann mentioned, the Tobacco Control Act currently covers only cigarettes, smokeless tobacco, and roll-your-own tobacco. The Act gives the FDA the authority to assert jurisdiction over cigars, little cigars, hookah, pipe tobacco, and any other types of new tobacco products that may come out, but the FDA hasn't acted to claim that authority yet. And Ann mentioned that they have stated their intention to do so, and we don't have a timeline for when that might happen. The Tobacco Control Act also gives the FDA the authority to create additional regulations. So an example of an area in which they have created new regulations is the design of the graphic package warning labels for cigarettes. So now let's move on to the lawsuits. As I mentioned earlier, there were 2 separate lawsuits challenging the Tobacco Control Act and the FDA's authority over it. The first lawsuit was brought by 5 tobacco companies, including R.J. Reynolds and Lorillard, plus 1 tobacco retailer chain. It was originally filed in federal court in western Kentucky in 2009, and it challenges a number of provisions in the Act, which I'll talk more about in a minute. The second challenge was to the 2011 regulation creating the new graphic warning labels. So let's talk about these 2 suits in more detail. The first lawsuit challenges the requirement that tobacco ads be black and white only, the ban on saying that tobacco is approved by the FDA, the FDA's authority to enact a ban on outdoor advertising in the future, The requirement that cigarettes contain a graphic warning label covering half the package, the restrictions on sponsorship, sampling, tobacco-branded merchandise, promotional items free with purchase, marketing tobacco with other FDA-regulated products, the ban on reduced harm claims about certain products, and the FDA's right to create further restrictions on advertising and promotions in the future. So of those 11 challenged provisions, the court struck down just 2. The ban on tombstone advertising requirements and the ban on saying that tobacco is approved by the FDA. Because the court ruled against these 2 provisions, those 2 are not currently enforced by the FDA. Both sides are appealing the parts of the case that they lost to the Sixth Circuit Court of Appeals. A hearing there was held in August, and we're expecting a ruling from that court any day now. The case is almost certain to be appealed to the U.S. Supreme Court, regardless of the outcome at the Sixth Circuit. There's a couple other provisions that are also not currently being enforced by the FDA. The FDA is still contemplating whether and how to enact a ban on outdoor advertising, so that provision of the law has not yet taken effect. And as I mentioned earlier, the new package warning labels are being challenged in a separate lawsuit, so that is not in effect either. So let's talk about that lawsuit. The second lawsuit challenges the FDA's 2011 regulation establishing the actual pictures and messages that were selected by the FDA with input from the public for the cigarette warning labels. So this is a second challenge to the graphic warning labels. The earlier suit challenged the requirement in the Tobacco Control Act itself. This suit was also brought by 5 tobacco companies, including R.J. Reynolds and Lorillard, and this was filed in federal court in Washington, D.C. The district court in this case just held last week that the warning labels violate the First Amendment, but this case is also being appealed, so it's also likely to wind up in the Supreme Court, and we don't know if that ruling will stand or not. So what does all of this mean for communities right now? Well, the primary message is that it is still legal to pursue local policies in any of the areas that have been challenged in these lawsuits. There is no impact on California, because these are all outside of California's jurisdiction, unless the Supreme Court makes a ruling in the case that would apply to the whole country. If the Supreme Court ultimately rules that any of the federal tobacco restrictions are unconstitutional, then any similar local law would also become unenforceable. TALC will make sure to keep the state informed about the status of these and any other lawsuits challenging tobacco control laws. Please contact us if your community is interested in pursuing a law and you want to make sure that it's legal to do so, or if you want assistance with drafting a local law. Vanessa?
To talk, there were a couple questions specifically about what agency is going to be enforcing the FDA law in California. And in California, I believe that the FDA has contracted with the Food and Drug Branch of the California Department of Public Health. So that's the same agency that enforces the STAKE Act. And so they are, I don't know personally how exactly they're going to be launching the inspections, but that's the agency that's going to be doing it. So it's in an ideal world, it will be coordinated with what's going on with the STAKE Act enforcement. And let's see. We had another question about what does it mean to say, Lisa, this question is for you. What does it mean to say that the certain products are covered by the law?
So that means that the law applies only to those products right now. So the restrictions on every restriction included in the law does not apply to the products that are not covered. So that means it doesn't apply to little cigars, doesn't apply to pipe tobacco, doesn't apply to full-size cigars, etc. And so that's one reason why we are strongly encouraging local communities to go ahead and go beyond the FDA law to create their own laws that would go further until the FDA catches up.
Great. Vanessa, you want to try talking?
Well, getting back on track here, we've been kind of focusing earlier on the call really on kind of what, the federal status of things. But in this next section of the call, we really want to focus on, what this means here in California, and where does it leave all of us here in California in our local communities. So none of you in California are actually going to be surprised by the answer, because the answer, as it always is passing local policy, as Elisa was talking about, passing policies that go further than that federal FDA law. And here in California, our focus in the retail environment really is on tobacco retailer licensing. And one of the great things about tobacco retailer licensing is that it really allows you to include these plans, these additional laws that go further in the retail environment. So there's even more than is listed here, but these are some of them that you guys may be familiar with. And I'm not going to read them all since we're a little behind on time. But if you do want to know more about them, PHLP has a fact sheet about many of the different plugins, and we'll be sending it out after the webinar, or you can check their website to learn more about the different plugins. And also the American Lung Association in California did a public opinion poll of California voters on some of these plugins, and we'll be sending that out as well, and you can check that out. And, I should note that PHLP does have model language for some policies and model policies on a bunch of the different plugins that you can check out and use in your communities. And if you want to learn even more, PHLP and the Center held a complimentary webinar last November called Going Beyond RL, Emerging Tobacco Retailer Policies. And on this webinar, we covered a few of these plugins, ones that are circled here. And you can check out a recording of the webinar by going to either of our websites, and you can learn more about those plugins there. But for today, we're going to focus on just one of the plugins, because this is one of the ones that wasn't covered before. We're really going to talk about the ban on flavored tobacco products. And as Ann said at the beginning of today's webinar, we all know that the FDA has regulated and banned flavored cigarettes. So with the exception of menthol, which there have been a number of webinars about menthol, so you could learn more about that. But with the exception of menthol flavoring, it bans cigarettes with other flavorings, such as flute flavoring, chocolate, coffee, herbs, spices, all that sort of thing. But it did not cover flavored other tobacco products, so flavored little cigars, spit tobacco, dissolvables, hookah accessories that have tobacco. Those, are still out there. But what's exciting is that, the FDA law does not prohibit governments from working on this issue, so you can go further in your local community and close the loop by banning all flavored tobacco products. And only a couple of places have done this so far, and we were excited to hear that Rhode Island just did it in January. But here with us today, we're really excited to have two of the real pioneering communities on this issue, the First in the Nation policy and the First in California policy. So we have two speakers with us to talk more about their experiences passing a flavored tobacco product ban locally. And first up, we have from New York, we have Ann Pearson, who, as Leslie said, was working in New York City at the time that they passed the First Nation ban in 2009, although she was no longer there. And there's not slides. We're going to do this as a little interview while we look at this picture of New York City and get inspired by the work that Ann is going to be telling us about. Hi, Ann, are you there?
I'm here. Can you hear me?
Yes, I can. Great.
Great.
So maybe to start off our little conversation, maybe you could talk a little bit about why you guys in New York even thought there was a need for a ban on flavored tobacco products.
Sure. The rationale for New York City's local law was really identical to the rationale for the federal ban on flavored cigarettes, which had gone into effect just a few months earlier. But basically, flavored tobacco products really are proven to appeal to kids because the flavorings mask the really harsh taste of tobacco. So the hope was if we could restrict youth access to really appealing flavored tobacco products, we could reduce the number of kids who started smoking.
Great. So then what is actually covered in the policy?
So the New York City law prohibits the sale of all flavored tobacco products that aren't covered by the federal product standards. So Those products include flavored cigars, chew, dissolvables, and shisha, basically all the products that Elisa showed on the right-hand side of her slide, basically anything other than flavored cigarettes.
Perfect. And so I'm guessing there was probably opposition with a kind of new cutting-edge policy like this. So what kind of opposition did you guys face?
You're right, there's always opposition, and the greatest opposition in this case came from the cigar industry, which lobbied the City Council to exempt cigars from the law. And they tried to make the case that the law was intended to prevent youth smoking and that high-end cigars simply aren't consumed by youth. The fact is, though, that many kids do smoke cigars, and that one of the reasons they smoke them is because they come in such appealing flavors. So for this reason, the Council didn't concede to the cigar industry's request for an exemption, and cigars are covered by the New York City law.
Great. And then, on the tobacco control side of things, what kind of steps did advocates take to pass this policy?
Well, tobacco control advocates did a really great job of demonstrating to the council members the scope of the problem in New York City, because this is a law that would affect only New York City. So they had to prove that this was that flavored tobacco products were a problem for New York City kids. So one way they did this was by sharing local data. For example, they shared local data which showed that between 2001 and 2007, the percentage of kids in New York City who smoked cigars and cigarillos only nearly tripled. And because those products that are affordable and accessible to kids are typically flavored, it stood to reason that the availability of flavored products was fueling this trend. The other thing that the tobacco control advocates did a really great job of was rebutting the argument that cigars are smoked by adults and not by kids. And one of the ways they did this was really to let the products speak for themselves. They presented policymakers with baskets of flavored tobacco products that they'd purchased in New York City stores. And when the policymakers received those baskets and they were filled with things like chocolate chip cookie dough flavored blunt wraps, they absolutely understood that kids are the intended market for these products.
I love the image of the basket filled with those blunt wraps. Great. So then you were saying that even after the policy was in place, you guys were sued by the tobacco industry?
Yes. In December 2009, a lawsuit was filed by U.S. Smokeless, which is a subsidiary of Altria. And the lawsuit alleged that the local law was illegal because it was preempted by the Federal Family Smoking and Prevention and Tobacco Control Act. About 3 months ago, though, the court dismissed the lawsuit, finding that the law was in fact not preempted. It's a great opinion. I would encourage everyone to read it because it's very affirming of what localities do. The court concluded that even though the law gave the federal government the authority to establish product standards for flavored tobacco products, as it has done for flavored cigarettes, the law very clearly reserved to states and localities their historical power to regulate the sale and distribution of tobacco products. And that's precisely what New York's law did. It regulated the sale of flavored other tobacco products, which is very consistent with the local authority that the court affirmed.
Great. So then what's the status of the policy now?
So the law is now in effect. So it's currently illegal to sell flavored other tobacco products in New York City, except in a very small number of cigar bars. And I would encourage anyone who's considering working on this type of law to reach out to the really great team in New York City to learn more about any issues they have relating to enforcement.
Great. And then just as a way to end this conversation, I was curious if you had some lessons learned that you can share with everybody here in California who might be thinking about trying to pass a policy like this in their local communities.
Sure, I would have a couple pieces of advice. The first is that it's really important to be able to demonstrate the scope of the problem in your jurisdiction. So to the extent possible, health departments really should try to use their surveys and other data collection methods to collect data about kids' use of flavored tobacco products so that when policymakers say, how many of our kids are using these things, you really have a hard number that you can show them. And the other tip I would give, and I've made this previously, is that these products really do speak for themselves. So go to stores, take pictures, buy products, and share them with your policymakers. As I said earlier, when you see a chocolate chip cookie dough flavored tobacco product, you really know that these are intended for kids. And the last tip I would have is just to work closely with your lawyers. You want to draft a law that is not only legal, but that's also easy to enforce and to administer. It's really important that the law is clear enough so that everyone knows what can and can't be sold. And that's particularly true for retailers. You want this to be fair to retailers. So it's important to have a law that makes it very clear to them what they can and can't have on their shelves.
Great. Thank you, Anne. Thank you for all of that information. And we're going to have time for some question and answer after we have Janie talk. So if you guys have questions for Anne, you guys can put them in the chat box now, and we'll have time for question and answer at the end. So thank you again, Anne.
Sure.
And here is her contact information for a split second. Oh, maybe not. There's her contact information for a split second. So in addition to having Anne on the call with us today, we're also really excited to have Janie Burkhart, who is with the Public Health Department in Santa Clara County. Santa Clara County, it's really exciting because they passed the flavored product ban as part of their tobacco retail licensing ordinance back in 2010. And so a really groundbreaker here in California on banning flavored tobacco. And so we wanted to be able to share their experience with the rest of us. So hi, Janie, are you there?
I'm here. Can you hear me?
Hi there. So, yep, I can hear you.
Great.
So how about for you guys? Where did the idea of a flavored ban come from in Santa Clara County?
Well, we had what was maybe kind of a rare situation of having an extremely supportive and very progressive champion in our county board president. And we just took the opportunity when it arose to create comprehensive policy. We had the opportunity to draft a report back to a board referral asking us for information on the potential need for what they termed as anti-tobacco policy. And this was kind of this board member's cause for his presidential year on the board. One of the policies we recommended obviously was tobacco retail licensing, and we argued that in addition to the 1,000-foot ban on retailing near schools, as well as a 500-foot ban with retailers not being in proximity to one another, that we should also have protections for youth against flavored tobacco. So our board champion was really supportive, and between the education he was able to provide to his fellow board members, as well as what public health was able to provide to them, they were convinced. A lot of the things Anne talked about as far as some of the meetings and products we shared with them as well, that and data that convinced them that this is definitely an issue and that youth are being targeted. So the ordinance did indeed pass, and this was despite opposition, active opposition from Altria, the Cigar Association, and the Tobacconists Association.
Yeah, so what is the current status of the ordinance?
Well, we're a little bit in flux right now. We actually held enforcement of the ordinance. We passed it in 2010, as you said, held enforcement, and have reported back to our board twice on this, and expect to report back again in October of this year. We used a lot of the same language that the FDA did as far as characterizing flavor. So this is a full tobacco product ban, flavored tobacco product ban, but we were challenged by the same characters again, Altria, Cigar Association, Tobacconists Association, and our local retailers, as to define exactly what characterizing flavor meant and what products this would apply to. So we have been following what New York is doing. My understanding there, and in talking to many of my colleagues there, is they have been, although they are currently enforcing their law, there are some limitations, including that I think they're going mostly on marketing. A product is considered to be flavored if it is marketed as being flavored. But they were considering working with potential vendors to develop lists of, to test product and develop a comprehensive list of all products that would be considered flavored. And then, of course, that would also entail the need for maintenance of that list, because we know that the tobacco industry will respond to this sort of limitation by creating new products and repackaging existing product with new marketing to try and get around the ban. So in Santa Clara County, that has been a barrier for us with regard to resources, both to try to establish such a list and to maintain it. Pardon me. So we're currently on hold in our actual implementation of the ban.
Well, we appreciate you guys doing all this hard work and figuring it out for sure. Well, do you have any, as we wrap up here, do you have any lessons learned that you can share? You know, if other cities and counties here in California are thinking about doing something like this in their communities, do you have any lessons learned for people?
Well, I would encourage people to pursue this. I know that we all hope the FDA will step in and regulate flavored tobacco at the national level, but in the meantime, I think that we local jurisdictions really have a role to play by helping to educate the public and raising this issue at local, state, and national debate level. The tobacco industry, obviously, we know is marketing dependent on targeting youth for their new customers, and they really are threatened by these policies, I think. So as far as lessons learned, I'd just say that although we here in Santa Clara County haven't been completely successful with this policy yet as far as implementation, we've made Altria uncomfortable enough to fly executives out here to visit us repeatedly. We know they've hired a local operative that follows our programs, moves, our local coalitions moves, and haunts the halls of our county board offices. So I think if we could make a concerted effort around the state, around the nation to get these local policies passed, that it definitely threatens them and will affect their marketing strategy.
Amen to that, and thank you again for all of your guys' hard work on this and leading the way here in California. I've put Janie's contact information up here really briefly, but we really hope by hearing both the story here from Janie and then from Ann in New York, you guys can really see some of the benefits and challenges of working on these, bans on flavored tobacco. So I'm going to turn it back over to Leslie because we're going to do some question and answer with the remaining time. So Leslie?
Great. Thanks, Vanessa. Thank you, Ann and Janie. That was really informative. So this question is for both Janie and Ann. Someone's wondering if you have any surveys, sample surveys that you use to go in, and you were saying it's really important to show policymakers what these kinds of products are, and we're wondering if you had a process for doing that where you went into the stores to see what kinds of teen-friendly or youth-friendly products they had there, or if it was more anecdotally collecting information.
Well, at that time we didn't have a formal survey instrument. We did go to a lot of stores, and we just took a lot of photos and purchased products themselves. But we didn't formally collect data about the extent to which these products existed on the shelves. But I think one of the suggestions I was trying to make was to try and add that type of data collection to the youth surveys that health departments do. So for health departments that conduct these surveys to ask youth about their health-related behaviors, you can specifically add a question, if you don't have one already, that asks about whether or not you use flavored tobacco products. At the time when we worked on this law in New York, our survey didn't include that question, but since then, because of the problem of flavored tobacco products, many jurisdictions have added that type of question to their youth surveys.
Great. Janie, do you have anything to add from your perspective?
No, not really. We don't have any really, as far as what we presented to our board and the products, we didn't have any formal survey data. It was more anecdotal. Locally, our YRBS, we do have some questions on use of flavored tobacco, but they are very general.
Mm-hmm. There's another question that really applies to both of you, and it's more of a kind of procedural question. When the tobacco company sues you or threatens to sue you, is it the government themselves that they're suing?
In the case of New York City, the flavored tobacco law was passed by the city council, so the lawsuit was against the city of New York. It wasn't against the health department because the health department just provided data. It didn't, in fact, use any authority to pass the law. It was against the city of New York because the council had enacted it.
Mm-hmm. Fortunately, in Santa Clara, we have not been sued yet, since we're not that much. We're not truly threatening them since we're not implemented yet. But that's good to know. But it would be our county that would be sued, I assume, if we were challenged.
Yeah, sounds like it. Great. So, Vanessa, do you want to add anything about the poll results to help people with their data collection?
Yeah, our survey that the American Lung Association did last year was a public opinion survey. It was conducted of California voters last April or May. So we'll send out a link about it. And we do have questions that we asked about whether people supported various plugins. I don't believe that we asked about the flavored ban, however.
Right. Yeah, one of the questions they were looking at both limiting flavored tobacco products and also size, single cigars or single packages. We also got a suggestion from one of our. Go ahead, Vanessa.
Oh, I was going to say we did ask the public about the single cigar cigarillo. So that question is there. Yeah,
because I would agree with the speakers that your average city council member is not aware of these kinds of products. That's not where they do their shopping. It's not part of their normal routine. So I think it can be very illuminating for them. So one suggestion from a participant is that instead of actually buying the tobacco products themselves, you could ask retailers for empty flavored tobacco display boxes, as an example, and then they still retain the smell and list the flavor. And then go ahead.
Oh, this is Anne. I was just going to comment on that, and I do appreciate how awkward it is to recommend to anyone that they buy tobacco products. So I do so very reluctantly, but I will say that it can be very important for the policymakers to see the products themselves. And I'll give you just one example. In New York City, the speaker of the city council was incredibly troubled by the fact that some of these products were sold in these tubes that looked like lipstick, and felt that the certain products, because of their shape and size, really were being marketed to teen girls. And I'm not sure she would have understood that had she just seen the box in which they were packaged. So I am reluctant to tell anybody to go out and buy tobacco products, but sometimes a limited purchase can be effective.
Yeah, that's a great point. Thanks. Last question is, the New York lawsuit, does that set a precedent for lawsuits against flavored tobacco products? I think the question is really asking kind of what impact does the New York decision have on communities in the rest of the country?
Well, the decision in New York was just in the New York District Court, so it's not binding on any courts outside that jurisdiction. Although I do expect that other courts would look to the decision and hopefully be influenced by the findings and rationale.
Yeah, it's obviously better to have a favorable decision out there than an unfavorable one, even if it isn't going to be binding. Good. Well, I want to thank, again, all of our presenters, Anne Simino from the FDA, Elisa Laird-Metke from PHLP, Vanessa Marvin, Ann Pearson, and Janie Burkhart, all talking about flavored tobacco products. Again, everyone who participated in this webinar will receive a follow-up email with a link to an evaluation survey. We really encourage you to fill that out. It helps us in doing future webinars, and also a link to the recording if you want to listen to this or pass it along to anyone you know. And it will also include all of the contact information, including, again, the information about making complaints to the FDA. So thank you, everyone, again, for participating, and have a great rest of your day.